LifeLine.
Today we're going
Mondays
to
at 12
continue the
noon
topic
on
of
Facebook Live.
balance and
Parents,
the
grab your
importance
preschoolers and
of
join us for
balance
fun
in
with
every
music and movement
aspect of
on
our
Tuesdays and
lives.
Thursdays from
So
11
we'll be
a.m. to 1
specifically
p.m.
touching
on
on
Zoom.
balance in
Every Friday
the
evening,
different
we gather on
roles
Facebook Live for
and the
a
different
time of prayer.
hats that we
Let's
wear.
pursue God.
So, for instance, I'm a mother, so that's one of the hats that I wear.
The
I'm
Refreshing
also
Life
an
Outreach and
employee.
Missions team presents a
So
holiday
those are
toy
some of the
drive.
areas
You
where
are
we
invited to
work in.
donate or
So when
nominate
I
a deserving
think
family
about
to receive gifts this holiday season.
think about
For
just
more
the
information,
scale
check
and
out
how
our
life
website at
is forever moving forward, and there's
refreshglobal.org.
always going to be us juggling and
Join
working
our
towards
texting
a better
community.
balance. Sometimes
Text
for them
refresh
being
to
off a little bit.
55444
There's
to
just
stay connected so we
that
can
whole
refresh the
heart
world
of
together.
movement towards trying to be as balanced as possible. So I want you to think about for a minute just what is
Hello, everyone, and welcome to another LifeLine, LifeWire Monday. We hope that everyone is well. We hope that everyone is staying safe as we continue to just navigate through the rest of the year. We're almost towards the end of the year, so we are grateful that we have been continued to be kept, to be protected, and to have the resources that we need, even in times of a lot of uncertainty. So we're grateful that we're still here. We are praying here at Lifeline and LifeWire that you all continue to stay safe. Hopefully, the things that we've been sharing throughout this year has been helpful, and just kind of finding some balance, finding some coping skills, some strategies, some solutions to how to just stay in a place of groundedness, stay in a place of being anchored, in a place of being solution focused, so that you and your family can maneuver through all of the uncertainties of this year. And we kind of want to continue on with providing solutions for you all. This month we have been discussing depression. We know during the holiday times it can be very challenging for a lot of different families and a lot of different people for various reasons. And especially right now, it's definitely a hard time because social gatherings are it's different now. We have to be aware of our family members who may be a little compromised in their health. We have to be mindful of how often we can gather, or when we can gather, or how we can gather. So that can put additional stress on not being able to really see our loved ones that we want to. And so with so many changes happening, we can have some depressive feelings and sadness that we've been talking about, how major depressive symptoms, or how just depressive symptoms kind of show and how they can affect our everyday lives. And so what I wanted to share with you all today is specifically looking at major depressive disorder. So sometimes in our kind of everyday conversations, we can say, I feel depressed, or I just been in a depressed mood. But I really wanted to kind of give you all and share with you all really what is the difference between, having a depressive moment or moments and having clinical major depressive disorder. Those two are similar, but they're very different in terms of how they show up and how they impact us in our everyday lives. So again, I always like to kind of share some education with you all, because for me, education about everything is very important, because it's a foundation for how we can, one, behave, respond better, and then provide some solutions. So before we even get into that, let's just breathe for a minute. This may be the only time of day that you have to yourself, or that you are intentional about being present with self. So let's just take those grounding breaths to help us kind of focus in and honor where you are right now, and then we'll move forward. Okay. So we'll do 3 rounds of breath where we inhale through the nose and then exhale out the mouth. Okay, so we'll do 3 of those. When you're ready, you can close your eyes, you can keep them open, whatever feels comfortable to you. We'll start with the inhale through the nose, and exhale out the mouth. Inhale through the nose, and exhale out the mouth. Sigh it out if you need to. Good. One more inhale through your nose. Really fill up your body with air. And then exhale out the mouth. Okay. Okay. So, as I shared, I'm going to be talking a bit about major depressive disorder. And this presentation for us today is really going to look at what major depressive disorder is. Because sometimes, like I said, we can feel depressed and have moments where we are in depressive seasons. But major depressive disorder is a chronic, ongoing a period of time where you feel down. And there's some markers that indicate that you may be struggling with major depressive disorder. But I want us to kind of really get an understanding of what that is. So today I'll be sharing that. I have a video to kind of help us really give some visuals of what it may look like. And then I also can kind of later on break down some of those things and then provide some insight, hopefully, onto how it plays itself out, how we can work through that, and then some resources of treatment. Okay, so let me share my screen here. And as always, you all are so welcome to share this content, to ask questions in the question box area. And then let us know if you have any questions. Definitely reach out to us. Okay, so major depressive disorder. Excuse me. And this is taking the criteria from the DSM, and the DSM is a diagnostic tool for measuring how clinicians, psychiatrists, psychologists really look at what the criteria is in order to qualify or diagnose someone with major depressive disorder. So here is a video I would like to share with you all.
Dove Advanced Care's new formula, enriched with 1/4 moisturizers with natural oil, leaves underarms feeling healthy and protected, and you more confident and carefree. Effective protection, kind to skin.
Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you'd normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. And it's not just behavioral symptoms. Depression has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. And because depression's symptoms are intangible, it's hard to know who might look fine but is actually struggling. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help. But there are very effective treatments. Medications and therapy complement each other to boost brain chemicals. In extreme cases, electroconvulsive therapy, which is like a controlled seizure in the patient's brain, is also very helpful. Other promising treatments, like transcranial magnetic stimulation, are being investigated too. So if you know someone struggling with depression, encourage them, gently, to seek out some of these options. You might even offer to help with specific tasks, like looking up therapists in the area or making a list of questions to ask a doctor. To someone with depression, these first steps can seem insurmountable. If they feel guilty or ashamed, point out that depression is a medical condition, just like asthma or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it, any more than they could will themselves to get over a broken arm. If you haven't experienced depression yourself, avoid comparing it to times you've felt down. Comparing what they're experiencing to normal temporary feelings of sadness can make them feel guilty for struggling. Even just talking about depression openly can help. For example, research shows that asking someone about suicidal thoughts actually reduces their suicide risk. Open conversations about mental illness help erode stigma and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will learn about depression, and the better the treatments will get.
So I know that's probably, a lot of clinical, psychological, therapeutic language, but I'm going to do my best to try to break it down so that we can understand what it really is and kind of the symptoms of it. So again, as the video talked about, there are different criteria and different symptoms that we have to be aware of about what major depressive disorder is versus, having depressive moments. So here are some criteria that is prevalent for those who have qualified and met for major depressive disorder. So there's depressed mood most of the day or every day, diminished interest or pleasure in activities, significant changes in weight, and that can be weight loss, weight gain, insomnia or hypersomnia, restlessness or slowed movement, fatigue, feelings of worthlessness or excessive guilt, poor concentration, and suicidal ideations or attempts. So 5 or more of these symptoms need to be present during a 2-week period. So persistence is definitely key, and then also the time frame. So we want to kind of be mindful that, different things will happen in life that causes us to maybe be in these states where we may have lost someone or changes in our job. We may have lost the job. And these things are present. We may not feel interested. We may have, difficulty falling asleep, staying asleep, changes in weight. We may feel guilty over something that may have happened. So these symptoms are definitely time sensitive. So if you have experienced these as a result of some major adjustment, we may look into an adjustment disorder, right? Because it may take you about 6 months to kind of adjust to major shifts. However, if these symptoms are still persistent within a year's time or past that 6 months time, we may start to look into major depressive disorder. And that's really to give way to really looking at maybe these symptoms have been present before the adjustment or before the change, but it just has kind of been on a lower level scale. And sometimes really dramatic shifts can really kind of up the presence of the depressive symptoms. So again, we want to be mindful that these symptoms are time sensitive, and that they also need to have at least 5 or more of them to be present in order for it to be clinically diagnosed as major depressive disorder. Okay. And again, if you have any questions, definitely let us know. Reach out to us, kind of type them in as we're going so that we can try to answer those questions. Okay, so the video, it did talk about the prevalence of major depressive disorder. And this is some statistics from a couple years ago, but it's still relevant. I just recently checked it, but it's still relevant. About 7% of the U.S. population, is diagnosed with major depressive disorder, based on the criteria we just went through. 4.3% is severe. So severe symptoms are often those where they're consistent, where they're persistent, where it's really hard for clients to kind of get out of that cycle of having those really rough days and maybe only having a small number of days where they're okay. Then there's also some mixed in emotions with that. There may be depression with anxiety. There may be depression with psychotic features, meaning that they may have some hallucinations, that they may, feel detached from their body. So there's a lot of other symptoms along with depression, but kind of want to stay here for now. So there's about 4.3% of the population who definitely struggle with major depressive disorder. And for the adult population, the age range from 18 to 29, or 3 more times is likely to be diagnosed with this disorder than those who are over 60. Now, again, that's not to say that those over 60 don't have depression, or it's not likely that the onset could start during the 60s, 60-year-old range. But we often see the onset around that 18 to 29-year-old age range. In females, unfortunately, research has shown that they're, kind of 3 times more likely to have major depressive disorder. And it's not that males don't. Often we find that males don't seek out help as frequently as females do. So the research unfortunately isn't, as heavy on the male population because they are not as readily open to receive help. But I'm pretty sure that there are just as many females as females who are experiencing major depressive disorder. We just don't have a lot of context for that population because they want to handle it a different way, or they don't feel comfortable with seeking out support. And again, adolescence shows up for them as well. So we really have to be mindful that this disorder it is prevalent across the lifespan, from early adulthood to in our later years in life. It kind of expands across the lifespan, and that's because major depressive disorder is really one of those kind of lifelong things that some people may deal with and struggle with. But that's not to say that you cannot have a great handle on it. There just may be a lot of other factors that make it kind of something that we have to continuously work throughout the lifespan. So again, some onset and course and onset of this disease. It kind of peaks in its 20s. From females, it's around the 15-year-old age, and then males, it's in their 20s. The course, it kind of varies according to the individual and their medical history. So sometimes those who are diagnosed with this, there can be no symptoms for a while. Like I said, for that example of an adjustment disorder, you could be fine and kind of have a low level grade of depressive disorder or disorders, and you can function okay. But once something maybe very traumatic or something that is very different that happens and you have to adjust to it, then there may be a higher level of symptoms that come along with that, because there was such a shift in your world. The onset of some of those more tangible, visual, drastic depressive symptoms and behaviors can become more present. And again, chronic depressive symptoms increase with other things such as, anxiety, sometimes substance use and abuse, and disorders come along with that. And so sometimes it can be hard for people to deal and manage with this kind of overwhelming sense of dread, sense of worthlessness, sense of hopelessness. And sometimes people, the only way they can try to navigate that is through some substances. So sometimes you can see people kind of pair, some type of substance related support to help them navigate through their emotions, through their thoughts, through their feelings. But there are other ways to cope and deal and manage with that, and we'll talk about that a little later on. Okay, so just wanted to share this with you all. If you all are hopefully interested in seeking therapy for, whatever it may be, but specifically for major depressive disorder, I want you all to kind of know some of the tools that we use to really assess the severity of the disorder, and then also, if you meet the full criteria for it. So there's Hamilton Depression Rating Scale, there's Beck Depression Inventory, there's some questionnaires. So these are, there are tools and resources, that we use to really help us to give an objective view on if someone is really struggling with major depressive disorder. So we want to be able to provide you all with a knowledge base and what we as clinicians, as social workers, as psychologists, as psychiatrists, what we use to help everyone so that you can feel comfortable with asking questions, because this is your life. We want you to be able to be knowledgeable and to be insightful about how it is that we provide solutions and support for you all. So just kind of asking some questions to whoever your provider is so that you can feel comfortable with knowing how it is that we treat and support you. So these are some of the tools that we do use. And they're basic questionnaires. Some you can fill out on your own. Some we may sit down and work with you to fill them out. And so absolutely, you're free to ask questions about what it is and what assessment tools we are using. So this is some things that we kind of want to be mindful of in our how we look at treating depression and how we look at the cultural aspects of depression. So age, disability, ethnicity, religion, social and economic status, sexual orientation, heritage, national origin, gender, all of that contributes to how depression is manifested, how it is maintained, how it is supported or not supported. So there's a lot of different ways that depression impacts us based on who we are and how we are in society. So for example, one second. So for example, if we look at maybe social economic status, right? So someone who may be in a lower SES may have trouble with seeking support or having support because they may not have the resources to reach out to a psychiatrist who's going to prescribe medication, or someone who can help them with actually having a counselor or be able to have the resources to pay for counseling. That may be a cultural barrier to being able to even seek out services and maintain services. But with several of the clients that I work with, I do have a sliding scale for those people who may not be able to work or have the full amount to pay for the full coverage. So sometimes it's okay to ask, asking, is there a sliding scale fee? Do you all accept, patients who may need a little wiggle room with being able to have services? You may not be able to pay the full amount, but ask if there is some resources for you to be able to pay maybe half or get a payment schedule to receive services. So you can kind of look at how, some of these different areas really affect how people may perceive treatment, how people may um, have access to treatment. And oftentimes in our faith-based or religious-based communities, depression may be something that isn't really talked about. Depression may be looked at something, unfortunately, sometimes that we just pray away, or we go to someone else to kind of help us get rid of whatever may be the spiritual aspect of it that may be present and could very well be present, but it also needs to be a biological approach to it as well. Again, we talked about in the video that there are some neurological, meaning some brain abnormalities that may be going on that will require medical attention in addition to whatever religious or spiritual support that you have. So please really kind of consider all of the cultural impacts of how to manage, navigate, and work through depression. So I'm not going to kind of go through everything here, but there are 3 definite kind of categories to how this disorder, major depressive disorder, can start, can progress and develop. So there's a biological aspect, there's an environmental aspect, and there's a personality kind of aspect to it with genetics. If your family member has a major depressive disorder or depressive, symptoms, it's most likely that, you as the child or you as a first kind of a first, what's the word I'm looking for? First contact or a first generation of a family member who has major depressive disorder, it's likely that can develop with you, but it isn't set in stone, right? So it's not to say that, oh, because my mom or my dad has major depressive disorder, that doesn't mean that I'm going to, right? We're not saying that is a definite, but that's just something to be aware of and to be mindful of. One, so that you can probably get a head start on how to, be mindful of, how do I make space for myself? How do I take the time to balance, that work-life balance that we talked about? A lot of times when we, experience a lot of stress, that can kind of cause some depressive symptoms, some low levels of engagement, some just lack of wanting to do anything because it may be poor work-life balance or not enough time spent with self and giving yourself permission to kind of take moments to just pause and relax. So again, just being mindful of family history is important. I would definitely ask, family members to have some conversations, have some hard conversations about, what's in our family? What are the medical history in our family? What is the psychiatric or psychological family history? Because when we don't know, we are sometimes unfortunately caused to repeat the same cycles. But when we do ask questions and we do start to have those open and hard conversations, we can then begin to look for solutions and how to move forward. So again, there's a biological aspect to depressive disorder. And I want to really look here at this hormonal part and this neurological part too, because most people think that it's just, oh, you're just, you're just being sad. You're just a sad person. There's really a biological piece to depression where, again, there may be some imbalances in our brains, some chemical imbalances, even thyroid issues. One of the clients that I worked with, I kind of suggested her to go to seek out if there was something going on with her hormones, and she found out that there was. And so she's getting hormonal treatment because it affects her mood. So it's not necessarily just, the environment or the type of disposition that you have as a person. It could really be biological, and you have to kind of sit down and work with physicians, doctors, neurologists to see if there is a chemical imbalance there. So there's some environmental issues too that also contributes to the onset and progression, development, persistence with depression disorder. Stressful environments, childhood and upbringing can definitely also have an impact on how the onset of MDD it starts, when we have a lot of childhood adversity that is prevalent for us in our community. We're at a higher risk for developing depression. Again, it's not set in stone that you will, but it often can lead to some later depressive feelings, thoughts, and behaviors later down on the line. And then I also want to kind of think about how our thoughts and our personalities and our cognitive traits can contribute to and help maintain depressive thoughts and feelings, especially for those who are perfectionists and very self-critical. We can get in this loop of wanting to always be perfect, uphold these high expectations, and when we don't, we then become very self-critical. We become very hard on ourselves. We become very overwhelmed with not meeting the mark, and then we get into this spiral train of thought where we're not good enough, when we feel inadequate, and then that kind of puts us in this depressive state and way of living, which is something that we as clinicians are trained to help you get out of, as far as how you think about yourself and how you approach your work, but really being mindful of those who really kind of struggle with perfectionism and being really self-critical. Those who struggle with that seem to have a higher prevalence of depressive disorders. Okay, so I know we're kind of talking through a lot today, and I hope it's making some sense. But again, wanting to pause for moments of questioning, pause for moments of just kind of reflection. So we talked about, the onset of it. We talked about the prevalence of it. We talked about the criteria of it, and then how it shows up biologically, environmentally, and then, just personality-wise, how that can contribute to the onset and maintenance of major depressive disorder. Okay, so want to look at treatment approaches. So one second, guys. Okay, treatment approaches. So there's different ways that we approach how to work out and work through MDD, major depressive disorder. The big one that I'm frequently using is cognitive behavioral therapy, and it really addresses unrealistic thinking, negative thoughts, focusing on kind of those cognitive distortions and replacing them with healthier, balanced, more realistic thought patterns. And how do you kind of get out of these thinking traps that really lead to those depressive processes and how you interpret the world? A lot of it can come from our environment. If we have seen a lot of traumatic things, or if we've had a hard life, then we have reason to believe that sometimes things just won't work out in our favor, or there's no way that something can get better, right? We can definitely give space and validate your experiences, but we can also look at how can we empower you more to look at a different way of problem solving, right? What within, even if your environment may not change, how can we empower you to be able to respond to it differently? What are the tools that we can give you as far as how you think about yourself, how you think about your ability to problem solve, so that once you're in an environment or where you're in a situation that may not be as favorable, okay, how can you then enter into that situation feeling a little bit more grounded in yourself and a little bit more knowledgeable about how to diminish those catastrophizing thoughts, right? Everything isn't black or white. Sometimes there's this gray area that leads for a little bit more of wiggle room, a little bit more room for things to be improved on, or maybe looked and looked at a different way. So just kind of challenging some thought processes that leads to depressive thoughts leads to depressive feelings and behaviors, because everything starts with how we think. And so everything else will follow from there. So we kind of really work on reconstructing how we think and our thought patterns. Interpersonal therapy, the goal is really to kind of communicate with our significant others, social arena. So the premise of it is really that a lot of the conflict that we experience with depressive disorders come from a disconnect with our interpersonal relationships. And so we can look at different areas such as bereavement. Death is always a part of life. And so how do we deal with that? How do we deal with the loss of someone? Transitions. We talked about that with LifeWire a couple of months ago. Transitions can be very challenging for some of us and can kind of lead to us again to be in these places of depressive and adjustments, lead us to be in moments where we have to adjust. And then we can become very depressed in those adjustments. Struggles with relationships, role disputes, and then interpersonal deficits, and how do we just kind of look at the absence of those major life events that we haven't had yet, or kind of have to be halted. 2020 is a great example of that, where a lot of us wanted to go off to college or wanted to graduate or wanted to get married in a certain way, and we couldn't because of the circumstances. So really looking at how do we, again, better address, communicate, problem solve, how we adjust and manage those kind of major areas in our lives. And then looking at hormonal testing, really looking at how our hormones, especially as women, how hormones affect our overall function and functioning, because as women, we have these wonderful bodies that the Lord God has given us, but they are very complex. They are very hard to kind of keep in balance. And so when sometimes one thing isn't in balance, that throws a lot of other things off. So again, I definitely encourage women to kind of go for some hormonal testing to see if your thyroids are off, to see if there's something with your just your sex glands, if they're off. All of that contributes to depressive thoughts, depressive feelings. Okay. We can skip through that. Okay, so let's kind of look at some challenges for treatment. So we want to be able to, again, kind of give you all some, encourage you all to go for a treatment, but sometimes people aren't always ready because there may be some barriers to how they even perceive treatment or the resources that they have to get treatment. Some environmental factors may be, just kind of coping with past or present trauma that they're not ready to deal with yet. You have to be ready to start that process. And though we can encourage you and you can encourage others, sometimes it's just hard for people to really sit with what happened or what is happening, and wanting to be able to deal with it on their own. But we have to, kind of encourage people, family members, friends, even ourselves, that there are healthier ways, and people who are there as part of their job, their work, and their mission to really support people who are struggling mentally, psychologically, emotionally, and spiritually. Another thing that we did talk about was low SES. Sometimes, those financial resources may be hard. Lack of access to treatment, lack of resources in the neighborhood sometimes may not have all that within the neighborhood. So especially if we're looking for outside of our area for resources, it can be hard to get there. But one of the benefits of kind of the social distancing and doing things virtually, you can connect with a therapist who may be across the country that really speaks to who you are, speaks to where you are. And you can still connect with them, even if you are, let's say, in Chicago and you want to meet with someone who's in Texas, right? You can do that. There's telehealth therapy that's available. You can be able to still connect with them, even though they may not be right in your backyard. And here's another thing that we didn't talk about, medication. So medication can be a hard thing for some people to kind of wrap their brains around, about having to take medication as a form of treatment, right? So as the video talked about, talk therapy, as well as medication management, especially with clients who have major depressive disorder, who may be on the severe end of the scale, and who also have some history of significant trauma, may need medication because there is a chemical imbalance, right? Again, there may be something that's off chemically. And we don't want you to feel as though that if you take medication, right, that's a bad thing. You know, medication is maybe necessary for you. There may be, again, just like there's a physical ailment that you have in your physical, the rest of your body, such as high blood pressure, cholesterol, whatever that is happening internally, physically, there's something that is imbalanced, right? So the same way that the rest of our body requires medication to get things back to a place of balance, our brains are a part of our bodies, and they may need some medication to help with balancing out those chemicals, those neurotransmitters that really need assistance. So medication may be hard for some people. There may be a pushback to wanting to take medication, but oftentimes the clients that I work with, who take medication for major depressive disorder, they find that when they don't have their medication, it's very hard for them to focus. It's hard for them to get out of bed. It's hard for them to just do anything. But when they are on their medication, they feel more stable, more present, more relaxed, and they have a more enjoyable life. So those are some things that may be challenging for treatment, and some things that may be concerning for clients and just for people that we want to support and help with. Okay. Yeah, so the prognosis of major depressive disorder is it's something you can live with, right? It's something that we as clinicians, as social workers, as psychiatrists, as people in the helping mental health field, we don't see it as something that is a death sentence, right? It's not something that, if you are given the diagnosis of major depressive disorder, that doesn't mean that you cannot live a fulfilling life, right? It just means that there may be some additional steps that you have to take to really be purposeful about the life that you want to live, with the challenges that you have been faced with, and also having the resources handy to make sure that you continue to stay above water, because sometimes a lot of my clients just feel like they're just kind of floating, kind of drowning sometimes. It's hard for them to kind of get a footing on things, um, but with the different treatment options and the interdisciplinary approach to working with them, some issues like the stressful life events, social supports, physical illnesses, all those things don't seem as hard to manage if there are some support there, right? If they are connected with treatment, if they're connected with more than one way of solving and treating major depressive disorder. So there are different ways that you can still live a very fulfilling life, even if you are, diagnosed with major depressive disorder. So we just wanted to, give that give that picture of knowing that you don't have to live a life that you feel stuck in, where you feel um, unempowered, or where you feel kind of victim to what has happened to you. There are so many resources that you can connect with, so many people that you can connect with to get you to the place where you really would like to be. It just really takes some effort on your part, as well as staying connected with those resources and people who can help in moving you towards your best place. So as always, LifeWire is here for you, to support you, to connect you with resources, to connect you with community, because it is important for us, not just to have solutions for you individually, but to create a cultural community where we can talk freely, listen, provide solutions in a well-rounded area so that you can feel supported, connected, to live, thrive, and be full and on purpose. So I remember Candace talked about last time there's some hotlines that are available. So if you can kind of go through the rest of our videos from last Monday, and maybe some resources that Shar has handed out as well. There are so many resources for you all and for all of us to connect with, to make sure that we are seeking the support, right? We want to make sure that you are knowledgeable about what major depressive disorder is and what depressive disorders look like. Some of those do's and don'ts, how you may communicate, how you can talk to family about, is this disorder present in our family? Has anyone struggled with this? If so, let's talk about it. Let's see how we can find some support. So we really want you all to stay informed, stay knowledgeable, and then provide solutions so that you don't feel like you're in this alone, because you aren't. There so much is shifting and changing, but we know that the God that we have and God that we serve is steadfast and always providing solutions for us. And that solution may be in the form of seeking help, right? That solution for a prayer may come in the form of medication, may come in the form of seeking out counseling, may come in the form of having a hard conversation with family members. So please, 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 we encourage you to always be mindful that we are here to support. We are here to uplift. We are here to provide education for you all so that you can make responsible decisions and feel empowered to respond appropriately. Okay. As always, if you have any questions, please contact us on our Facebook page, on our website, and we hope to hear from you soon. If you would like more information on this major depressive disorder, its symptoms, how it may show up, and treatment, please feel free to reach out to us. And stay safe, guys, okay? Let's take another breath before we leave. There's a lot to talk about and a lot to digest. Hopefully it wasn't too overloading for you all, but just kind of give yourself permission to take one final breath through our nose and then exhale it out. Thank you all for being here. I hope you stay safe and well, and we'll talk with you soon. All right, bye.
Join us for a time of mental health wellness tips at our LifeWire LifeLine, Mondays at 12 noon on Facebook Live. Parents, grab your preschoolers and join us for fun with music and movement on Tuesdays and Thursdays from 11 a.m. to 1 p.m. on Zoom. Every Friday evening, we gather on Facebook Live for a time of prayer. Let's pursue God. The Refresh a Life Outreach and Missions team presents a holiday toy drive. You are invited to donate or nominate a deserving family to receive gifts this holiday season. For more information, check out our website at refreshglobalnfp.org. Join our texting community. Text REFRESH to 55444 to stay connected so we can refresh the world together.